Hello, Facebook, YouTube, and Twitch. We are officially live. It's April 6th, 7 o'clock. It's time for a SOOF presentation. Give everybody a little bit of time to come on and get in here. If you can't make it live, it'll be up on our Facebook page or on our YouTube page. Go ahead and check out some of our other videos. We've got discussions on institutional racism. A lot of great stuff up there on our YouTube page. A little video telling you about Stand Up for Equity, what we're all about, and some great information for our GoFundMe, our website, standupforequity.org. Lots of great stuff. Well, with us today, we have Candace Graves. She is with Compass Health Network. She's the Director of Substance Use Recovery and Community Engagement. She's going to give us a presentation on substance use disorder. Super excited. There's going to be some great information, some great statistics, but then also some resources. If you or anyone you know is experiencing substance use disorder, be great resources for Compass Health and some other providers, depending on where you're at in Missouri. And then on April 22nd, Candace will be back in our second installment of the Tough Conversation series to do a little group counseling on substance use. So without further ado, Candace, I'm going to turn it over to you.
Yes, thank you. And thank you guys for joining tonight. I'm very happy to be here. Substance use is definitely a passion of mine of helping individuals. So we want to dig into some of this information. So we're going to talk about the effects of substance use among minority populations. But I do want to preference that, yes, there are a lot of minority populations, but we're specifically going to focus on racial disparities. So let's move to our next slide, where I definitely think it's important that let's highlight the definition of substance use, right? So it's a disease that affects a person's brain and behavior and leads to an inability to control the use of legal or illegal drug or medications. And so for me, I thought this was very important because sometimes we think of substance use as only illegal drugs. We forget that the medications that we are sometimes prescribed can be used and can be overused or misused. That's also a form of substance use as well. So I definitely wanted to highlight this definition. So in our next slide that we're going to go to, I definitely wanted us to look at some national trends. I think this is important. We'll look at national as well as the state level, in addition to what we're doing at Compass as well. So nationally, looking at 2020, that first 4 months of 2020, there had been an 11.4% increase in overdose fatalities. So that is huge. What that is saying is all of the overdoses from 2019 plus 11.4% is what we've experienced just in the first 4 months of 2020. That is wow. And we know that COVID was definitely a factor in that, it kind of came out of nowhere, immediate isolation, maybe people losing their jobs, new stressors that we hadn't really had to deal with. So we definitely saw increases in substance use on a national level, as well as state and even local within our agency. That was like, wow. So at least 30 states have reported increase in opioid fatalities since the start of the pandemic. Wow. And then alcohol sales have risen by 25%. So looking at a recent analysis of urine drug tests, which are, basically a urine drug test, you pee in a little cup, by Millennium Health, which is a national laboratory. The trends that they have shown are pretty consistent with what we have been seeing. Basically a 32% increase of non-prescribed fentanyl. And so later in this presentation, we'll also really talk about fentanyl, what it is, 20% for methamphetamine and 10% for cocaine. Also only looking at a few months in 2020, not even the entire year. So these are definitely alarming numbers. So in the next slide, I want to address something that goes back years and years and years. You may have heard this phrase, the war on drugs, right? It was this national crisis. Way back when Nixon was in office, he coined that crisis as the war on drugs. I really want to talk about how federally these laws that were implemented, who they really impacted, what groups of people did they really impact? And it's something we really don't think about. So back in 1971, due to the war on drugs and the things that were implemented, there started to be an increased presence of drug control agencies. The government started to to fund these agencies even the more. They began to increase in size. Mandatory sentencing started to be connected with substances. So people are now going to jail. They're now prison, and they're now getting harsher sentences as well. Back in that time is when the no-knock warrants were introduced as well. And so I thought it was important to show this, to kind of just show this alarming trend, and then it gets to the Reagan administration, still keeping this same trend of the zero tolerance policies that ultimately led to increased incarceration. And so I know you all have probably heard of Just Say No. If you've been in school, back when I was in school, the DARE program was really big. It was everywhere. So you may be familiar with that. This was a national program that was implemented under the Reagan administration. And just as we continue through the Clinton presidency, as well as Bush, you still start to see just upward trends of mass incarceration due to stricter laws that are being implemented. So in the next slide, we're going to stick to this slide, but I also want to give you just some more statistical information about that. We talked about the misguided drug laws that occurred during that time and the harsher sentences, which really, really produced unequal outcomes for people of color, right? So although rates of drug use and sales were similar across racial and ethical lines, so if the numbers are similar as far as rate of drug use, but the minority has an increased presence in incarceration, that shows the imbalance that we were experiencing during that time, that we continue to experience. So about 57% of people who were incarcerated in state prisons, and then 77% of people incarcerated in federal prisons from drug offenses. We're specifically talking about drug offenses, drug offense incarceration. They were Black or Latino, compared to 30% of the US population. So if this minority group is 30% of the US population, but they represent 60 and 70% of the incarcerated people for drug offenses, that is definitely an alarming trend. Definitely an alarming trend. So I also want to talk further about how minorities were impacted with this mass incarceration that impacted minority households. We're talking about the destruction it caused with families, right? So if I'm looking at the family system, there were 2.7 million children in the US who had one or more of their parents incarcerated. That's a lot. So out of that 2.7 million, about 2/3 of those parents that were incarcerated were for nonviolent offenses, including a substantial proportion who were incarcerated for drug law violations. So let me go even further. So we're talking about 1 in 9 Black children having incarcerated parents, compared to 1 in 28 for Latino children, and even compare that to 1 in 57 for white children. Those are definitely alarming numbers. And so I want you to think about, okay, if I've just been incarcerated, I've just gotten a felony, how does this impact me in society? What does it hinder my ability to do? So some states have policies banning those who've been convicted of a felony for drug related charges, for things like applying for government programs, food stamps, temporary assistance for needy families, TANF, which is like a cash benefit, as well as the inability to access public housing. That is huge. We know that when there is a housing crisis, housing is hard to find. Um, even if it's not even public housing, we're talking about landlords. They have the ability to turn you down for having a felony, for certain felonies on your record. Housing is a necessity. That's a part of basic needs. And so if you look at the charts, some states have amended those policies, but there are some who are still, there are certain things you cannot do when you are someone who has a felony. And so other things that come to mind is voting rights, stripped of voting rights, access to potential business loans, and just policies surrounding denying child custody. These are all concerning things, right? So in my next slide, we're just going to further expound on that. So we know if I'm saying that I'm having trouble finding a job because of this drug felony that I have, employment directly impacts your social economic status. It directly impacts your ability to even provide for your family or, take care of basic needs. If you're thinking about what was the population who was receiving government assistance, who was the population who was receiving government housing, all of those things, they're all interconnected. And of course, environment, lower education, again, housing stability, unemployment, access to treatment, and discriminatory practices. And I really want to go back to the access of treatment because I also want to talk about if you are a low income individual and maybe transportation is an issue, that's a barrier to getting to treatment, to accessing those services. There are some communities who do not want public transportation in their community. So what if you are that low-income individual and your only means of accessing treatment in this county that doesn't provide public transportation is Uber, cabs, different things of that nature? But we all know those can get pretty pricey really quick for there and back type of trip versus a bus pass. So there are other ways that minorities are being disconnected from the necessary treatment that is needed. And so with discriminatory practices, we are talking about we know that laws and things have been against certain groups from history. So my next slide, I definitely want to look at some more facts, right? Look at some more facts. So in 2014, this is when this information was collected, African Americans were 2.3 million, or 34% of the total 6.8 corrections population. African Americans are incarcerated at more than 5 times the rate of whites. Wow. The imprisonment rate for African American women is 2 times that of white women. If African Americans and Hispanics were incarcerated at the same rate as whites, prisons and jails would decline by almost 40%. That is significant. That is definitely significant. And nationwide, looking at our youth population as well. So African American children represent 32% of children who are arrested, 42% of children who are detained, and 52% of children whose cases are judicially waived to criminal court. Wow. And African American children represent 14% of the population. So if this group represents 14% of Earth, but then such a higher percentage as it relates to incarceration or connection to the judicial system, that definitely is a concern. Definitely is a concern. So I want to transition to the next slide. I wanted to show this slide. If you look and see the dark purple section on this map of Missouri, that is what we call a hot spot. So that is where St. Louis County, St. Louis City is located, up in that area. And so it's a hot spot because we have the river right there. There's like a distribution route for drugs that go along the river from Texas to Chicago. There's just a connection. And so St. Louis has definitely become a hotspot for fentanyl as well. And then, like I said earlier, the opioid overdose rates have significantly increased. And fentanyl definitely plays a part in that as well. So let's go to the next slide, which again, I just want to paint this picture and really show you what the racial composition of Missouri is. 82% white, and then everything else breaks down underneath it. So, wow. You know, I hope that helps put things into perspective as we're talking about this topic, because this is definitely an alarming issue that we want to address. So the next slide, I want to spend some time talking about Compass, the agency I'm connected with, our coverage area as it relates to SUD services. So I guess we cover about half the state there. And so the previous map I showed you of the dark purple where St. Louis was located is actually connected to the green area that you can see on this map. And so looking at the consumers that we serve on the pie chart, majority of our consumers are in the eastern region, which is the green section. They are the closest to St. Louis. And if you look at our map to help put it in perspective, that literally is the smallest coverage area, but they have the most need. And so resources are definitely important. We're always seeking new resources and trying to connect with different agencies, because there's definitely a real need in that area, specifically with the overdose rates, with concerns with limited access to services. And we know that this past year with COVID, has definitely put a strain even the more on ability to access services. So many places either transitioned to virtual or had to temporarily close or different things like that due to COVID. We were able to transition to virtual platforms to continue those services because we definitely saw a need due to just the increased use just across the board that we saw just across Compass, across the state, across the nation, just in general. So the next slide, I want to further put things into perspective for you regarding the population that we serve at Compass. So if you look at the numbers, the bottom number is our total for clients, whether they were in SUD outpatient services versus SUD intensive outpatient services, and then our adolescent services as well. And we roughly serve about 230 youth across the state for our SUD youth services. Obviously, with the adult services, it's definitely much more significant. We're looking at about a little over 5,600 total. But if you look at the racial composition of who we serve, majority of those clients are white or Caucasian as well. And sometimes people put other or unknown for their race, but that's the data that we have within our agency, our composition makeup. So next slide, I really wanted to highlight just the overdose rates that we are seeing within Compass. So if we're looking at 2020, as you can see, methamphetamine was the number one substance that was involved in overdose. Fentanyl was second, and then heroin, which is an opioid, was third. So those are the top three. And this is literally for the entire year of 2020, right? So next slide, though, is specifically looking at the first half of 2021. About the same amount of overdoses from the full year of 2020 to where we are now in 2021. And like we're not even, we're basically not even halfway through this year. So definitely, again, just alarming trends across the board. And what I wanted to bring your attention to specifically is that for 2021, fentanyl is the leading cause of overdoses. So I definitely want to make sure we talk about fentanyl, what it is, some of the things that our agency has noticed, preventative measures as well. We want to make sure we get this information out there. So next slide, I want to further talk about Missouri overdose facts specifically. So obviously drug overdose deaths have increased about 21% in the first 3 quarters of 2020 compared to 2019. Deaths amongst African Americans increased 37% compared to 16% amongst Caucasians. The St. Louis metro region accounted for about 55% of all drug overdoses in Missouri in 2019 as well as 2020. And then the St. Louis region accounted for about 80% of all drug overdose deaths in Missouri amongst African Americans. That is definitely a significant number for sure. So next slide, let's talk about fentanyl. What you need to know about it. One thing I want to put in perspective, because when we think about fentanyl, we always immediately go to, okay, this is an illegal substance. But fentanyl has actually been used in a legal manner for quite some time. Fentanyl is used for things such as like major surgeries, pain management, things of that nature. But we have to preface that there is a difference in the amount. So if it's being prescribed in a legal manner, the amount is much smaller compared to what is being used illicitly, right? It's like 50 times more potent. And then again, with the trends we've seen with COVID, people are maybe they are not able to access the person they've typically been buying from. So they'll try something new. They'll try the same substance with someone new, purchasing from someone new. But the thing is, you don't know what's in that. You don't know if their recipe is different. You don't know. So what is happening is fentanyl is cheap. It is cheap, and it can be cut. People are cutting other substances and adding fentanyl to stretch the product. So you could be thinking, oh, I'm purchasing meth, and not realize that it has been laced with fentanyl. That's an issue. Because fentanyl is often described as 80 to 100 times stronger than morphine, or about 50 times stronger than heroin. Wow, that's significant. Fentanyl has been moving through the street market. It comes in a powder form and can be injected, smoked, or snorted. And again, it has also been found in other substances like heroin, meth, cocaine, and pressed pills. So we believe that fentanyl is leading the overdose rates for the reason of sometimes people just don't know that the substance they purchased has been laced with fentanyl. So overdose deaths involving fentanyl have quadrupled in recent years. Let's see. Obviously, you can't simply overdose by touching fentanyl. It must be introduced into the bloodstream. So I'm gonna, next slide, I just briefly touch on stimulants and opioids as well. So when we talk about stimulants, we're talking about methamphetamine, cocaine, amphetamine. I'm sure you all have possibly heard of Adderall. That is a legal prescribed drug. It is sometimes misused because of the similarities that it has with meth. And stimulants come in pill, powder, rock, and can be injected as well. And as far as opioids, we're talking about heroin, Oxycontin, fentanyl, Percocet, like the pain medication family. And those can be tablets, capsules, syrups, solutions, and suppositories as well. So next slide of let's talk resources. So first and foremost, let me start talking about OE&D. That just means overdose education and naloxone distribution. So just in case you haven't heard of it, what it is a nasal spray that you can use. It can't be used on yourself, but you can use on someone who may appear to be in an overdose state. We have the Good Samaritan law, meaning there are some buts to it, some exclusions, but basically, if you have administered naloxone in good faith, there will be no charges brought against you. Let's say if that person wasn't in an overdose state. So where can you access it? So let me jump to the mohopeproject.org. So you may live in a rural area with not a lot of resources. What you can do is go to mohopeproject.org, and they have a feature on their website where you can type in your address, you can type in the zip code, city, state, and basically it will tell you all of the resources in your area where you can access Narcan for free. So even if you are not the one who is using, you definitely want to have Narcan. If it's a close loved one, have that nearby. And one thing we always encourage, we are an agency who believes in harm reduction. So we don't necessarily, we help work people towards abstinence, but that's not the goal. The goal may just be um, working towards using 5 days a week instead of 7. So we always encourage people never use alone. I should have added that there is a phone number. It is called Never Use Alone if you were to look that up. And basically, you can call and someone will stay on the phone with you um, while you're using, checking in, making sure you're still with them, type of situation. It's definitely a great resource. So there are local health departments who also have Narcan, naloxone. It's just generic versus brand name. So I may use them interchangeably. So the local health department may have naloxone in your area. You can actually go to the pharmacy and purchase naloxone as well. Now, I don't recall how much it is. But it's not free if you go to the pharmacy and just purchase it directly. If funds are an issue, I would definitely suggest the mohopeproject.org or your local health department. And one thing I want to say about going to your local pharmacy, the beauty of this is you do not have to have a prescription. Now, all pharmacies do not carry naloxone, so you definitely want to call before you go. But those who do, you do not have to have a prescription. You can just go purchase it outright. Also, Medicaid does cover it as well. So I'm also going to talk about Preferred Family Health. They have various locations and cover parts of Kansas City, Missouri, Illinois, and Oklahoma as well. I love the Missouri Network for Opiate Reform and Recovery. Great resource out of St. Louis. They take walk-ins. They offer detox ambulatory services, and we know, well, from my experience, detox services have been really rare sometimes, especially during COVID. But just even outside of that, every place does not offer a detox services, and they do. They are a great resource. That we do link clients to often, because with my agency, if there's something we don't offer, we try to connect you with places in the community that offer the services you need, or whatnot. And then Rediscover, which covers the Kansas City area. And I also wanted to provide dmh.mo.gov, because if you go to their website, they literally have a link of just a list of pages and pages and pages of every SUD, substance use disorder provider across the state. I mean, every mental health provider, it's all types of resources on their website as well. If you're just like, I'm really not sure what's in my area. And so I'm going to go to the next slide, because I definitely want to touch on Compass Health Network. So the list of counties we serve are listed. I won't read them all, but again, our service map shows that we serve pretty much half the state. So we probably serve your county. I would say definitely call. You can call this 844 number that's listed. And even if we don't serve your county, we will let you know who is the agency that does serve your county. Because again, our goal is, regardless of who you are, we want to help get you connected to services. And Compass is like a one-stop shop. We offer behavioral health in addition to substance use services, pediatric and family medicine, as well as dental care. We also offer SATOP services at certain locations, as well as residential services, OUD clinic services, which is opioid use disorder, and for those who may need medication assisted treatment and things of that nature, we have a special clinic we do offer employment services as well, in addition to peer support and case management for those. So definitely check us out if there is a need. So next slide, I have my resources listed, but I definitely want you to write down my email address. Maybe you have a question about something that was in the PowerPoint, or just like, hey, I want more information about this or that. I'll definitely be happy to help you. And of course, I don't know it all. So I will definitely find out if there's something I don't know that you have asked. But again, it's cgraves@compasshn.org. I hope something in this presentation was useful and helpful to you. And definitely thank you for joining.
Thank you so much for an awesome presentation.
Man, I unmuted my mic, huh?
I was like,
I'm gonna actually link your email into the chat here, so if anybody can come in and
sounds good.
They can just go ahead and get that popping.
Perfect.
Yeah, thanks for watching, guys. If you guys do have any more questions for Candace, just a reminder, she's going to be back with us on April 22nd. It's a Thursday, 7 o'clock. Now, that's going to be our Tough Conversations series, so that will be closed for privacy reasons. But having said that, it'll be a safe space if anybody needs to come in and talk about, some tough things to talk about. That'll be the place to do it. If you'd like to attend that, go ahead and send us a message. You can reach out to Candace as well. If you have any questions, you can reach out to Candace. You can reach out to us, and we'll do our best to answer anything like that. Yeah.
And this Tough Conversation series that we're presenting this month on the 22nd is specifically involving substance abuse related issues. So anything concerning use, abuse, overdosing, anything that's substance abuse related, this will be the Tough Conversation series to attend.
Like I said, if it's you or if it's somebody you know, you might want to suggest sending them over to this. It'd be a really great resource for them to have. So again, thank you guys for watching, and we'll see you next time.
Bye.